Can you take melatonin with alcohol? Melatonin is often prescribed to those over 55 years old that have a problem sleeping or experience sleeplessness. Inadequate sleep can mean anything like waking up early, not feeling rested upon waking up, not being able to fall asleep, or waking up for a very long time at night. Although insomnia is fairly common, it generally doesn't last long. By taking it, you supplement your body's natural supply, promoting and improving the quality of your sleep. Some suppose that alcohol can help with sound sleep. But can melatonin and alcohol be taken together? Pros will not suggest you take these two things at precisely the same moment. Both are sedatives, but if you combine them, it may interrupt your usual sleep. It's also possible for drinking to enhance the unwanted side effects associated with melatonin, particularly headaches and drowsiness. They can have unwanted effects when taken, so you must always speak with a physician beforehand. How can you feel if taken together? Nearly all people may feel drowsy if they take them at precisely the same time. Others won't feel tired in any way, rather, they feel as though they are about a stimulant. Should you sleep through the full night, you might wake up feeling like you have a hangover. Even low-level mixtures of melatonin and alcohol can result in hangover symptoms like fatigue, muscle pain, and headaches. Besides, alcohol responds to specific medications aside from melatonin. Alcohol can make the medicine less effective, so that you shouldn't drink alcohol whilst on it. Yet, sometimes physicians may indicate melatonin to help those recovering from alcohol withdrawal sleep at night. Should you suffer from alcoholism and cannot sleep through the night, you should always talk with your physician before taking supplements. He might suggest alternatives, including OTC sleep aids. Adults of all ages must always make sure you drink only in moderation, for overdrinking can interrupt your sleep. 1. Read the instructions carefully. Always start by thoroughly reading the info that accompanies your own melatonin. It will give you information regarding the drug and possible side effects to watch for. Take the melatonin following the directions your doctor provides you, which is probably a pill per day a couple of hours before bed. 2. Require melatonin after eating. Take the medication after ingestion or using a snack because this can allow it to operate later on in the evening time. Don't break up the pill, instead, swallow it whole so that it releases gradually throughout the course of the next few hours. In the event you don't remember your pill and don't remember until right before bed, then take it then. Never take multiple doses with each other to compensate for your overlook. 3. Follow the recommended duration. They may prescribe it for 13 months or less. Don't mix alcohol and melatonin as it reduces the effectiveness of the medication. 4. Try to work on a sound sleep. Take other actions to promote good sleep, like reducing your intake of caffeine, especially in the day or afternoon, not drinking alcohol or eating heavy foods before bed, and exercising early rather than later in the day. Keep your normal doctor appointments so that he can monitor your own progress. Mostly, it is safe to take melatonin as a dietary supplement as long as you take a low dose, but you should always speak with your physician first. Children and women who are pregnant or nursing should never take melatonin without consulting their doctor. There are a few side effects linked to melatonin, all of which will disappear if you stop using the supplement. They may include small blood pressure changes, morning grogginess, vivid dreams, reduced body temperature, sleepiness. Should you're feeling drowsy while taking melatonin, you should not operate machinery or drive while on it. Always tell your doctor if you're taking melatonin during a medical exam, and tell him if you've got issues sleeping because it may indicate a health issue. Adults should take melatonin at a dose of 0.2 to 20 mg, depending on why it's used. Since the perfect dosage varies greatly between individuals, you should always speak with your doctor to be aware of the right usages and ideal dose to take. Melatonin is a natural sleep aid that has been steadily increasing in popularity over the last 30 years. While it does not cause sleep, per se, our own body's melatonin levels naturally increase in the evenings, activating your circadian reaction and encouraging your head and body to sleep. Sometimes, we experience disruptions in our sleeping cycles. This can be due to jet lag, insomnia, or forcing ourselves to become awake for college or work. In these cases, we can supplement with melatonin to balance out our levels in the short term, but it's not for regular long-term usage. Melatonin supplements help to regulate sleep cycles, so increasing our melatonin unnaturally encourages relaxation. They may be used until the body readjusts to the new sleep schedule or whenever it resumes generating enough cortisol by itself. Our bodies produce melatonin, which may explain why a lot of people feel comfortable using it. If our body produces it, how can it be bad? However, like any substance taken for medical reasons, it's important to understand how to use melatonin safely and efficiently. Simply put, it is dangerous to mix melatonin supplements with alcohol. Even though melatonin is naturally produced in your own body, alcohol may either weaken or strengthen the effectiveness of melatonin supplements, inducing additional handicaps. When taken with alcohol, melatonin supplements can cause side effects that include: beyond the chance of uncomfortable or disorienting side effects, mixing melatonin and alcohol may have more severe effects. 1. Dizziness. 2. Risk of falling. 3. Fatigue and drowsiness. 4. Difficulty breathing. 5. Sudden unconsciousness. If you pass out abruptly, you could be in extreme danger, particularly if you are walking somewhere potentially toxic, like on a sidewalk close to traffic or operating a motor vehicle. Accidents may lead to serious injury or even death, depending on the condition. Melatonin, when used appropriately, is best taken in tiny doses. The recommended dose is roughly a few mg an hour or two before you go to bed, but many factors might make it ineffective. By way of instance, if you are taking other kinds of drugs, drinking, or under a great deal of anxiety, then the melatonin might not get the job done. If that is the case, don't double the dose. If it doesn't work at the recommended dose, taking more isn't likely to assist. Even if the supplement is successful, your course of treatment should not continue past 1 or 2 months. If you must take melatonin after swallowing alcohol, wait for 2 to 3 hours before taking it. Know the possible dangers, and do not be scared to get help from your healthcare provider or pharmacist to understand it better.